I'm here today to give you an update on Maine's response to the Ebola crisis, particularly as it relates to travelers and healthcare workers returning to Maine from West Africa. Every step that we are taking to prepare and plan for our response to Ebola is to protect the health of Maine people. As part of the worldwide response to the outbreak, there are health workers from our country that are doing brave work by traveling to the afflicted countries to assist in battling the outbreak. Recognizing the risk, the federal government has moved to establish screening protocols for those individuals returning to the U.S. from one of these countries. This screening has limits in its effectiveness. We know that a health worker in New York who had no known breach in his protective equipment, unfortunately, later developed symptoms and tested positive for this terrible disease. Any traveler from West Africa who comes to Maine will be monitored for at least 21 days after the last possible exposure to Ebola. This is consistent with federal guidelines. This monitoring includes daily check-ins with a state epidemiologist for any signs of a fever or other Ebola-related symptoms. If any symptoms develop, they will receive immediate medical care. We have also instituted additional protocols for ensuring that those individuals with a higher level of risk do not unnecessarily make contact with the public. These protocols include voluntary in-home quarantine for someone who was known to have had direct contact with an Ebola patient. If an individual who came in direct contact with an Ebola patient has returned to Maine and is not willing to avoid public contact and stay in their home voluntarily during the period they are at some risk, we will take additional measures and pursue appropriate authority to ensure they make no public contact. For any individual who must stay at home for a period of time for this reason, we will do all that we can to make sure that the person has everything necessary to be comfortable and receive the care that is needed. We believe this is a common sense approach to minimize the risk to the health for the people of the state of Maine.